Welcome to Changing the Stigma. This is a show where we talk about mental health. We want to change the stigma behind mental health. A lot of folks don't come forward. It takes the average person about 10 years to come forward to raise their hand and say they need help with struggles with any type of mental health illness right now. Most people, if they have a medical issue, they will come forward and immediately seek help. So we need to make sure we change that stigma, because a lot of folks, they struggle day to day with depression, anxiety, other mental health issues, and what ends up happening is, unfortunately, they end up hurting themselves, others, all the way to taking their own lives too. So we need to make sure we change that stigma, make sure everyone feels comfortable coming forward about their mental health issues, because the earlier it gets addressed, the more successful people are going to be in their own lives too. So, and dear to my heart is veterans issues, especially when it comes to mental health. Being a combat vet myself, it's very hard for a lot of veterans to come forward because they're very prideful. So with that being said, my name is James Cline. I've been in human services since about 2012. I came back off of my last deployment to Afghanistan about 15 months. I went to 117 interviews and could not get hired anywhere, regardless of the fact that I had 3 college degrees. There was that stigma attached, too soon being back. We're not going to hire you until you've been back. So a lot of people figured that you're going to snap. And that's very demeaning to those that kind of signed on the line and served their country, their communities, and their states. So I'm very passionate, and I'm glad that I got into human services. I will admit, when I got into human services the first time, it was really just to collect a paycheck until I could find something else. But I got into it. I really, really enjoyed it, seeing how successful people are when they're in their lives. And the whole point of being in human services isn't to fix anybody or solve anybody's problem. It's really just to give them resources and make sure they know how to use those so they can be successful on their own. All right, I do have my first guest. I'm going to let him introduce himself, kind of what he does for work and things he does out in the community.
All right, thanks so much.
Yes.
So my name is Melbourne Moran, Jr. I am a licensed independent clinical social worker here in New Hampshire, the Commonwealth of Massachusetts, and most recently Washington State. So that allows me to be a psychotherapist. I'm also the owner of Wonderlust Therapeutic Services here in Nashua, New Hampshire. We're a small to medium-sized counseling agency with about 20 clinicians that serve the greater Nashua area. On top of that, I am also a state representative for the state of New Hampshire, serving Nashua's Ward 7. This is my first term, and I will not be seeking re-election this year because now I'm also a alderman at large for the city of Nashua, and that's a 4-year term, and I'll complete that in three and a half more years.
Right. So what kind of services do you provide at Wonderlust Services?
So we do outpatient counseling. Mm-hmm. We also have licensed alcohol and drug counselors, master level ADACs, that do addiction counseling as well. And then we have a couple of niche services that we offer. We do forensic clinical social work services through a contract that we have down with the Commonwealth of Massachusetts to help get people who are addicted to substances out of jail and into treatment programs. And then we also happen to have some guardian ad litem's and court investigators that also work down in the Commonwealth.
All right. So what kind of things do you see when it comes to, like the name of the show is Changing the Stigma. What kind of things do you see that's attached with the mental health stigma?
So one good thing that came out of COVID was that the mental health stigma of getting treatment and seeking help has diminished quite a bit. Okay. So recently I've seen more people seeking services, but there's still that, why am I not normal?
Right.
Right, and there's no such thing as normal.
Right.
Everyone has their own sense of stability or what they feel that is right for them, and trying to break the stigma of getting out to ask for health care, right. Mental health care in particular, addiction treatment, and helping people realize that they are normal. Right. It's just how they manage their day-to-day lives. Right. Other stigmas we see is, people have a tendency to demean people with a mental illness, so that people want to keep it secret, like it's not something they want to share. Right. And I tell my patients, let's talk about it. let's have a conversation about it. You don't need to go into the depths of your trauma history with any person on the street, but it's okay to say, yeah, I see a therapist.
Right.
What's wrong with that?
Right.
You know, it's like, yeah, I have a primary care doctor.
Right.
I need to go and get, you know, a physical every year. It's like getting a little tune-up.
Right. Everyone's so quick to come forward and talk about their medical issues. And most people around them, the ones that care for them or co-workers or friends, they're very quick to come forward and say, do you need any help, things like that. But you don't see that as often if somebody says, you know, I'm really struggling with depression. It seems to be a taboo subject, but I think you're right. Because of COVID, there's been a lot of things that have come out because of isolations. People have been struggling. More service has been put into place. And kind of goes along with that. Back in January of 2019, New Hampshire came out with their 10-year mental health plan. So having your own therapy business here in this state, what have you seen some of the changes that have occurred because of this mental health plan for the state?
You know, I think one of the biggest changes that I've seen is the mobile crisis response team mobilization in the state. They've created the statewide access point, so you can call this 1-800 number and seek crisis support systems 24/7 anywhere that you are in the state of New Hampshire, and they'll try to either speak to you over the phone, de-escalate you, or, and de-escalate is just a clinical word for making sure you're safe in the moment while they get access to other services and supports for you. Or they can send out and dispatch a clinician to your home, or try to get, if you're safe to do so, get into their nearest office.
Right, and I used to work with you at the Nashua Mobile Crisis Team. You were the director. You did promote me up to the senior peer support specialist. So kind of explain what the crisis team is, who gets sent out, and kind of what the process is if they get involved with the crisis team, and who can use it.
Yeah. First of all, anyone in the state of New Hampshire, any resident, any citizen, anyone that's in New Hampshire who's having a crisis, and you could just be visiting and you need support, you can, one, call that 1-800 number, or go to the local mobile crisis team that's in your area, and you can access a master's level clinician and a peer support worker. A master's level clinician is someone like me. They may or may not have their license yet, or they're working towards it, but they're a therapist.
Right.
They're there to solve your immediate problem that you're presenting with, to reduce that risk threshold. They're going to do an assessment risk to see if you are suicidal. You know, that's a stigma. Let's talk about that. If you're homicidal even, there's levels of homicide thinking that you don't need to involve police at all. You just need to talk to a therapist about it. Or you might experiencing some psychosis. And that clinician and that peer support worker is someone who's been through it before, who's now in the industry to try to help people get back onto their feet and give that one-to-one that a professional clinician wouldn't be able to relate to that person. And the goal is, one, maybe they need just to get an outpatient therapist. Maybe they need an admission to the crisis apartment, which is a 7-day admission. You get to see a therapist every day and maybe a psychiatrist if you need it. Or if you need an urgent psychopharmacology referral, in the worst case scenario, you need to go to the emergency department to go to an inpatient psych unit.
And the goal of the crisis team is to keep people from having to go to the emergency room.
Exactly. And now, in everything I do as a counselor is to think about, how do I keep someone out of the hospital? One, state of New Hampshire, still working on it, but we have a long wait list to get into any of these facilities. You can go to the emergency room and sometimes be stuck there for weeks. If you're a kid, maybe a month or more.
Right, so that's something else we can talk about too. So the crisis teams, the way they're currently set up is if you're going to go into an apartment for up to a week to kind of get stabilized, because sometimes you just might need a day or two to kind of relax, maybe vent to somebody, get some services in place, and you can go back home. Instead of having to wait in the emergency room, because the emergency rooms, I know why they're set up the way they are, but it's really just a bed and a TV embedded into the wall, and they're locked units, just to keep everyone safe.
And you might have a security guard out your room, and you're not getting any treatment in the emergency room. You might get a crisis person that comes in to do something called a mental status update, just to see if you still need to go to an inpatient unit, but there's no meaningful treatment happening. at a crisis apartment, I just want to clarify what an apartment is. Right. It's not some place where you're just lounging around all day. It's a crisis unit. It's a treatment program. Right. That's a lower level of care than an emergency room or inpatient psych. You're getting access to 24/7 counselors, sometimes nurses, psychiatry. It's a place to resolve the presenting problem.
Right, and these crisis units, the stabilization units, they're not for kids. They're for adults only 18 and older.
Right.
So that's where one of the things that we need to continue to work for here in this state is kind of like the CBAP program down in Massachusetts,
yes,
where they have an in-between place. And things haven't really improved here in the state because Concord Hospital closed all their youth units, and now kids can only go to Hampstead.
Correct.
Now with COVID, there were some more restrictions in place for the kids, so a lot of kids really had to wait a long time, like you said, a month or more.
Right.
I can't imagine spending 24 hours in the emergency room in one of those units, let alone a kid spending a whole month there.
And imagine the damage that that's doing to that child who's already in crisis as it is. And our state, over and over again, we used to have the best mental health care in the country. Year after year, the state of New Hampshire ranked #1.
Oh, really?
And then the devastation of cutting services and cutting back beds happened through previous leadership and current leadership in the state, and they're trying to make up for it.
Right.
But at the end of the day, the people that are suffering are the citizens of New Hampshire, and especially the children who get stuck in these emergency rooms.
Right. New Hampshire has a vast shortage for mental health professionals, especially child psychiatrists. There's not that many in the state.
Right.
There's a huge waiting list. We're talking 6 to 12 months or longer in a lot of places to go see a child psychiatrist. So with that being said, what's your volume of seeing kids in your services?
So I'm glad you brought that up. One of the things that I set a goal for myself when I opened this agency. I wasn't going to restrict my agency to a particular age group or a particular type of insurance.
Right.
We take Medicaid, all types of New Hampshire Medicaid, and we'll see kids as young as 4 years old, all the way up to someone who's 105.
Okay.
Right. But we have a good chunk of kids at our agency. I would say at least 40, maybe even 50%. And our agency carries about 500 plus patients.
Oh wow.
And when I say we're small to moderate, we're a player in this city.
Right.
And sometimes we will take. I'll explain to the viewers. You already know this as being working in the field, but you have inpatient psych. You have the crisis team, you have a partial program, then you have community mental health centers. Right. Then right under that you have my agency, outpatient mental health, where it's don't have the same supports as the mental health centers do. But we will still take some clients that may need mental health, community mental health services, but they also have a 6-month wait list just to get into their services. Okay. So we're doing our best with what we have. We'll work with community psychiatrists that are in the area. We'll refer out. We'll do our best. If someone's truly unable to be met, their care met at our agency, we will burn bridges if we have to get them into the mental health center, because that has wraparound services and things that outpatient just can't offer. Right. But we take everyone generally who calls. There's some people that are on something called a conditional discharge from a state hospital that might call. That's something my agency can't address. That's something that a mental health center needs to do. But we have a good chunk of kids, and we are doing our best after the pandemic to serve this community the best that we can. And I won't let insurance be a barrier to that. Right. And we've hired so many clinicians, pulling them from Massachusetts, paying more than other agencies just to make sure that we do our best job for the city of Nashua.
Yeah, that's great because all those services need, especially for the kids. So, kind of, what's your turnaround time when it comes to when someone makes their first phone call to you to the time they probably get first seen?
So it depends on their availability, right, and our availability. But we usually get back to them within 24 hours. Okay. And up until maybe even today, we were getting people scheduled same day or same week. Same day appointments are typically someone calls and they're just bereaved. They may have had a sudden loss. Someone just said you got to call somebody, and we'll maybe pick up the phone or see the voicemail that gets transcribed and say, all right, we need to call them right away. We might be able to offer them a same-day appointment. Because there's here and there, people cancel all this stuff. We want to fit people in. Right. We're not one of those agencies that are going to screen and pick and choose, because people need help.
Right, and I know there's some people out there that are in the human services field, even some therapists, And that's kind of what they do. They kind of cherry pick the individuals they want to work with. I know a lot of people I've worked with in the past, they don't want to deal with people that might be diagnosed with a personality disorder or severe PTSD. They want to deal with the depression and anxiety. I know myself, starting getting into it, you know, working towards my MSW to be like you are an LICSW, I want to challenge myself all the time and get out of my comfort zone.
Right.
And that way I want to make sure people are successful. So with that being said, who do you find in your experience up to this point tend to be people that are more successful? So I've been helping run some substance use groups. So a lot of those folks are there because they're court ordered. And a lot of them are not successful because they're being told to be there, not because they want to be there. So what do you kind of see the difference with people being successful?
You know, there is a ton of research out there on forced treatment not being amicable to getting someone to actually change their behaviors. When someone wants to change, or even thinking about changing, that's when they're most successful. When it comes to addiction, the change has to be stopping the use or transitioning. You may be going on a addiction treatment like Vivitrol or something. When it comes to mental health care, and someone, let's say, has a personality disorder, and they're going to have to want to change that in order to have any meaningful progress in treatment. You know, some people come in, even for mental health care, they're mandated by the court, you have to go to a counselor once a week. They maybe show up and just talk about their life all day, just looking to check a box. You know, we are seeing more people, though, that are invested, you know, that people want to change, they want to get past some past traumas, they want to get past the depressive thoughts, they want to make themselves a better person. And a lot of times, which I'm proud of at our agency, a lot of people might come in and not be working. And for whatever reason, and we help them get back to work by cognitive reframing. We want people to be, you know, do the best that they can with their limitations, no matter what they are. And day structure is one of the key aspects of keeping folks from being depressed, anxious, whether it's actual work, volunteering, or, you know, just having a gym routine every day. You know, want to build that structure, because there's a stigma in our field that we're just enablers. You know, I have found that not to be true for most of the people I've worked with. You know, we're not signing disability forms or anything like that. We're trying to really get people back to work and back into society where we all belong.
Yeah, you want to make sure that we are looking forward to making sure that we make those people successful by doing it with them, not for them.
Exactly. But you'll still get some people who want to, which is frustrating, but you know, that's just training on that end for the provider.
Yeah, not all training is equal, but that's, again, there's a lot of people in human services that are trained differently or educated differently, and that's kind of what pushed me towards the MSW way to do it, because it's kind of standardized across the country. A lot of point of views, no matter what college you go to for it. So I think that's going to make me as a social worker to be much more successful with those people. And even now as a case manager, I do the same thing, where I make sure I do it with these individuals, even if it might take a couple times doing it, to make sure they're successful once they leave. That way they don't have to come back. And that's one of the favorite things I like to say to these folks. In a good way, I don't want to see them again.
And that's one of the great things about clinical social work. You have all these other programs that you can become a mental health counselor, a family therapist or something. But with clinical social work, you're doing the psychotherapy plus the case management, and you see the macro and the micro systems and how people fit in. And you get a much better depth of the understanding of society and how people interact in society, whether they're, you know, a Fortune 500 CEO or someone just pumping gas. You know, you can see how they can fit into society as a whole and be functional, and they themselves feel valued.
And I know a lot of people don't want to come forward to a piece of it. It has to do with what you mentioned earlier about the insurance piece. You're not worried if they have insurance or not. And that's part of being like a case manager, is connecting them with different options for insurance and things like that. So my question to you is, since you're the owner of the business and you deal with a lot of the accounting piece of it and how it gets billed and things like that, how do you see, like, even state insurance and other private insurances, how are they treating the mental health piece? Are they treating it better or worse or indifferent compared to the medical piece these days?
So that's you're talking about parity. Parity between modalities of treatment for mental health and healthcare.
Right.
And you'll see that private insurances do it much better. Private insurances have much more resources available. They have higher reimbursement rates. Medicaid does their best. We have some great MCOs in this state that are doing their best what they have.
Right.
But you have to remember that they are on a very limited budget, where that's not the same for commercials insurance. And you know, one thing I do want to add too, my agency offers, right now we're offering to a certain extent free care at the soup kitchen, where people will come in seeking a counselor. They may or may not have insurance, but we're still going to see them.
Right.
You know, our goal is to get them on insurance and try to, you know, back bill if we can. But I'm willing to take the hit as the owner to make sure that person in my city, in the city that I live in, I raise my children in, and I serve, can get back on their feet and back into the community.
Right. And for those folks watching too, the Nashua Soup Kitchen, that's located on Quincy Street, right on the corner with East Pearl Street. Great organization. They do a lot of great work out there, providing food. I know the city of Nashua comes out with a lot of services. I see their public health van out there all the time and things like that. So that's great that you go in. How often do you go out there? Or
so right now we have a therapist there every Friday.
Every Friday.
Our goal is to work with them to get our counselors there a little bit more frequently.
Okay.
We have a space that we use, and we're trying the best, even if we have to send some of our students out, because we do have students that would be a great learning opportunity for them.
Right, and I just read a study about the access to mental health services too. So I got to get through that study in the next week or two, read that up. But it was a nationwide study about mental health and access to it. And that's another barrier when it comes to allowing those services and people having access and the stigma to it and things like that. So how do you think we as a state compared to our New England neighbors when it comes to mental health services here in the state?
So we're a bit delayed. Having worked in Massachusetts, you and I created pretty much one of the first mobile crisis teams, and where Massachusetts has had that for decades, right? And you know, it's like pulling teeth to bring best informed care and best practices to New Hampshire, because you have folks at DHHS who are set in their ways, have worked for the state for 30 years. You have these people from the community mental health centers who have worked there for 30 years, and they do it their way, the New Hampshire way. Sometimes the New Hampshire way is not the best way when it comes to health care. We know we have the New Hampshire advantage, which is great. But let's not use that for health care. Let's be better.
So what would be one or two things that you would change in the state that we're not doing that we could do better at?
I think one, parity for reimbursement for mental health care providers. I think that would really bring a lot of people in. We train a lot of people at our schools, but we ship them out essentially. They get higher paying jobs somewhere else. If we can increase our reimbursements through Medicaid or other avenues, we will get those people to stay here. When you're getting $76 an hour for a session from New Hampshire Healthy Families and $150 from Blue Cross, there's no incentive to take New Hampshire Healthy Families. You know, I'm a bleeding heart social worker. That's my incentive, but other people don't think like me. And we've been in scenarios where people aren't thinking that way.
Correct.
So, that's just one option.
Yep.
The other option is that if we could eliminate these contracts that are now being pushed by the mental health centers, where they tie them to 4 or 5 years at that particular agency. And they kind of hold licensure over your head. Like, let's allow people to get licensed and maybe have the contract say, as long as you work somewhere in New Hampshire. Or if the student loan reimbursement fund that the state offers would allow for a reimbursement beyond public service, that would be great. Because there's people who are psychiatrists who work in downtown Nashua, they own their own practice, and if they want to stay here, maybe a little bit of money reimbursing their loans wouldn't be a bad thing.
No, absolutely, because again, there's such a shortage here when it comes to that stuff too. So
looking at any way possible to keep them here, because eventually, we're in a provider desert when it comes to mental health care. There's 6+ months of wait lists out there. It's insane.
Yeah, and there's such a shortage when it comes to therapists and counselors and licensed independent clinical social workers. So And I've been involved in meetings up in Concord when I was managing the crisis team after you left, and I've heard the conversations at the state level about what nobody wants to do, integrated care.
Right.
All these community health centers have their own electronic medical records. They want to keep stuff in-house.
Right.
They're owned by different places, so if we can have it integrated, all the care across the state, we'll know that somebody went to the emergency room down here in Nashua, and then 3 days later they didn't like what they were told here, so they went over to Keene to get services, and that's going to reduce a lot of the costs within the state.
And reduce malingering. You know, that's
Yes.
another big thing that happens throughout the state.
Right.
And I'm glad you brought up the mental health centers again, because they are so siloed. It's very ancient how it runs here, the mental health centers. Other cities and, other states do a much better job. Tennessee, for example, does amazing. But the mental health centers hold with a firm grasp their power, and they don't want to let any of it go. My agency could offer functional support services. We have the providers to do so, but we can't, because the mental health centers would never allow that with their lobbying.
Right, and the functional support services is when individuals go out in the community and they help other individuals do what they call activities of daily living.
Right.
Shopping, going to appointments, things like that. So,
You know, we just need to break down the silos, and sometimes, yes, private businesses can do a better job than some of these quasi-governmental agencies.
Right. Well, I'd like to thank you for being my guest on the show today, Changing the Stigma. You're doing a lot of great work out there. Anything you would like to say to the audience before we kind of close up the show?
First, I think you're going to make an amazing social worker. I worked with you for years. I think you're going to be awesome at it.
Appreciate it.
I thank the people in Nashua for allowing me on this show too, just to talk about mental health. I talk about it at Board of Aldermen meetings. Tune in as much as you can every other Tuesday because we talk about important things for the city, including what public health and what other things are being done to address your needs beyond picking up the trash and paving streets.
Right, absolutely. All right, thank you for watching Changing the Stigma, and let's change it together. Thank you.